podcast, interviews with local health experts here in Warren County. I'm your host, Drew Crawford with Warren County Public Health. Today, we're excited to talk with Dr. Molly Kowaleski with the Pediatric Dental Group of New York. Thank God I got that last name right. Thank goodness I asked you. All right.
Not an easy one. You did it perfectly.
Absolutely. And thank you so much for taking time out of your day. I know it's the start of a new year, so you guys are I'm pretty sure you guys are pretty busy right now, as you know, I can imagine everybody is around this time of year.
Everybody's thinking about those Christmas cookies they ate. So
absolutely, right? That's the best time, and right before Valentine's Day, when you can start eating all the sugar and all the chocolate,
exactly. You
right?
just got to get your checkup in between those.
Yeah. And so before we talk about pediatric dental health, is there any fun facts that you have? If you wouldn't mind introducing yourself, how you got into the role, where you studied, things like that.
Sure. So I am Molly Kowaleski. I was originally Molly Westbrook. I'm actually from Boston Spa, so from around the area. And I guess my fun fact would really be I was kind of a strange kid. When I was in 7th grade, we had to figure out a science fair project, and my mom was like, Molly, just do something easy, please. And so I was like, oh, well, what can I do? We happened to have some baby teeth in our house. My grandfather was a dentist, so we just happened to have some teeth there. And I think the tooth fairy was nice and let us keep some. So I used my baby teeth and put them in all different liquids like Coca-Cola and milk, all sorts of things. Coca-Cola actually broke them in half. And so I had those teeth like taped to my poster board, and everyone was really grossed out and thought I was the weirdest kid ever. But that's kind of how I got interested in dentistry. And so that was my very strange way that I got interested in dentistry. And I just have always loved working with kids. And so when it came time to really start thinking about what I wanted to do, it was definitely pediatric dentistry. I went to Syracuse for undergrad, go Orange. And then went to Maryland and met my husband, who I've dragged back to cold upstate New York, and we have 4 lovely dogs.
Well, there you go. Awesome. I mean, but it really threw yourself into the deep end there, going ahead and collecting those teeth. But this it's really awesome to hear. And as you were talking about, I mean, the Coca-Cola literally broke the tooth in half.
In half. Yes.
Yeah, and I mean, it is absolutely wild. But as somebody who has little brothers, and as somebody who has friends that are older and they have their own kids, it's really kind of interesting to see kids. And I mean, especially with our experience of going into the preschools and pre-Ks, getting a child to brush their teeth is not easy at all. So why don't we jump right in? So for kids brushing their teeth, number one, why should they be brushing their teeth? It's a really easy thing that we always hear about. Make sure you brush your teeth. Make sure you do it for 2 minutes. Make sure you do it twice a day. All these other things. And why should somebody brush their teeth?
So the biggest, most important reason is your mouth. It's full of germs. And so really, no matter what your germs are doing, you want to brush those away and make sure that you're controlling the bacterial levels in your mouth. So when you're born, you're really born without a set number and type of bacteria in your mouth. And through your first few years of life, you pick up somebody's bacteria environmentally. And so that's just through sharing spoons, kisses, things like that. And what eventually will happen is you think that you gave your children your teeth. And although, yes, genetically shape wise, you did, but the bacteria, that was actually more of a environmental transfer. So whoever they get their bacteria from, if you're somebody who gets cavities in your family, you're going to be concerned that your children may have cavities. They have bacteria in their mouth that they turn sugar and carbohydrates into acids. And so anybody who gets cavities, they have these germs that make their plaque acidic. You have to brush your teeth if you have these germs, because if your plaque is sitting on your teeth, it's going to dissolve them, make them soft, and make you get holes in them. The first sign that you're going to see that your kid has this on their teeth is if you start brushing your child's teeth and you start noticing these little chalky white spots along their gum line, just when they're really early age, that's a sign that they've picked up those bacteria and that you're going to have to be more diligent. It's really important at that age, as soon as you start noticing any teeth are touching, that you have to floss the acidic plaque out of there. And that's why some people get more cavities than others, because they have those bacteria. On the other side of things, those people who are like, oh, I never brush it, or I don't brush very often and I don't get any cavities, you still have to brush your teeth. There are other germs that will attack basically your gum and tooth structure, and they're going to make it so eventually someday you can lose the bone around your teeth and things like that. So even if you didn't end up with cavity germs, you don't get away scot-free. There's other animals that you're going to be fighting in your mouth that you got to brush out of there. So very, very important from starting the second they get their teeth, brush their teeth, and honestly brush their gums before they get them.
Absolutely. And you brought up the word diligent, which I think is it's a very big word that to obviously talk about with kids. You know, obviously you have to be very, very diligent with kids and make sure that they are doing the things that they're supposed to. And, you know, this is really kind of shown through our statistics that we have, not for us in Warren County, but we actually had the CDC collected some dental health statistics through 2018 to 2022. And they found that 2 to 5 year olds, only 23% had cavities. And while that is a big number, 52% of children from 6 to 8 had cavities. So that's kind of the 6 to 8 is when parents are like, okay, you know, I'm going to trust you to brush your teeth before you go to bed and things like that. And it can have, you know, some major impacts on dental health in general. And so with that, as we were talking about being diligent with your kids, how do you get your kids to brush their teeth? I mean, it's always the thing of like, you know, I'm going to rebel and I'm not going to brush my teeth and mom and dad won't know, but how do you get kids to brush their teeth?
I will be honest, it's a fight. It's a tough thing. I think the biggest thing is if you have a baby, start young, get them in the routine. The second you can get them in a routine and just make it part of their life, then you're not fighting against anything. You're just starting that fresh. But if you've already gotten yourself into a situation where it's tough and, you know, just you have a really hard time getting your kid to brush your teeth, this is the YouTube generation. I oftentimes say, check out if Miss Rachel or Blippi or something like that has any of those, anybody they like that can kind of talk to them about these things. But otherwise, there's actually this toothbrush. I haven't gotten to try it yet, but it's called Hum, and they have one for kids that it's an app, and I think basically you can play games with it. It's almost like as you're brushing your teeth, you're trying to play a game on an app. They're kind of playing the game while brushing their teeth. And that's something that I was thinking might actually be a good investment for an electric toothbrush, something that makes it more fun, because this is the generation that's what they're looking for. They're looking for something to be like a game. Also, I always tell people you're going to want to take turns with your kids. So even though they're going to demand to be independent, they don't get a turn until you get a turn. And you're the parent, you have to make that decision and sell them. You don't get a turn brushing your teeth till I get mine. Another strategy I have is they can brush their own teeth in the morning, because that one's a little less important. And then you can brush their teeth at nighttime after all their food and things like that have been sitting there.
Absolutely. And, you know, for a lot of times we always hear the guidelines of brushing your teeth, but for anybody out there that may not know the guidelines of, you know, how to brush their teeth, what are just some general rules to follow for, you know, just general dental health, making sure you brush your teeth? How many times a day should you do it? How long should you be doing it? And other things that you can do to take care of your teeth.
So we kind of focus on the 2 rule, 2 times a day, 2 minutes is really, really important. The 2 minutes is really just to make sure that you're having enough time to get everywhere. I say those little timers for kids are great, or just brush for the first 2 minutes of a song. If you have a hard time struggling with brushing 2 times a day, I let people know that I'm a realist. I do want you to be brushing in the morning, but if you really have to drop one, that's the one to do. You don't ever want to skip brushing your teeth before bed. You want the last thing that goes in your mouth at night to be the toothbrush with some toothpaste, and nothing after that other than water. And even that, if you can try to avoid water, you want to try to keep some of that toothpaste on your teeth, so that it actually has time to work, and that fluoride has some time to soak into your teeth if you're using fluoridated toothpaste.
Alrighty, and you know that's the best part. You know, great segue into it. Fluoride. It is something that was brought up in Warren County. We just had our anniversary for the putting fluoride in our drinking water for, I think it was a couple years ago, but it was just a few months ago that we just had the anniversary for it. And you know, a lot of people were just kind of questioning, what is fluoride? Why is fluoride good? You know, it doesn't sound like a very good element. It's on the periodic table of elements. It doesn't look very good. So you know, for somebody like myself, where I study a lot of chemistry and I'm a huge nerd for that, I can understand. But for everybody else, it may not be as, you know, common knowledge. So what is fluoride? How does it help out your teeth? And, you know, for somebody who may be looking for fluoride and it's not in our drinking water, how can they get that fluoride supplementation?
So this is something that's really important to me because as a pediatric dentist, I really care about these kids. And I hate the notion that like it's a conspiracy with dentists that we're coming to poison you with fluoride. That's just not the truth. We do a lot of research into the health and safety of these things. And we really want to be recommending what is best for our patients, their overall health. So fluoride is basically a substance that we use that it's part of the process to help remineralize your teeth. And what that means is as these acids from the bacteria that are eating your food, as they break down your teeth, what fluoride can do is it can actually reharden your teeth in those areas and can actually strengthen it harder than your original tooth structure. They say that teeth that have fluoride incorporated are actually stronger than teeth without it. They're more resistant to those acids that your germs would produce. And it's all about the dosage, as with anything. If there was somebody who they passed away from drinking too much water, anything in certain dosages is going to be damaging. It's just the correct dosage. And honestly, the main damage we're seeing if you had too much fluoride is mainly fluorosis and things like that, which is where you get too much fluoride in your teeth. I will say there were some studies that were done in China where people were concerned about IQ and things like that. And I delved really deep into these studies, and those were levels that were toxic and poisonous that they have not found in new studies in New Zealand with there being any association with IQ or anything like that. I think it's something that's been, water fluoridation has been done very safely over the past almost 80 years. It's been in place since the 40s, and the levels that we're doing are very low levels that are really to benefit incorporating that fluoride into your teeth and making them stronger. If you don't have fluoride in your water source, then the topical fluorides like your toothpaste, the fluoride you get at the dentist, all of those things kind of help provide an effect where you're still going to get some fluoride that's going to strengthen your teeth. And if you're concerned about your children not having fluoride in their water, either the dentist or a pediatrician can write a fluoride supplement that can just help provide them some fluoride while their teeth are developing. Those are really the years where you want to have systemic fluoride to kids because the theory is that as their teeth are developing in their plasma levels, that you're getting fluoride to their developing teeth. So it's really interesting, all of the things that they're showing with research, the benefits that it provides.
Absolutely. And I mean, it's really something kind of interesting because for somebody like me, I always assumed that fluoride was in a lot of drinking water. And what I found out when I took this position and we started reading through our community health assessment and all of our data was that there's no fluoride in our drinking water up here in Warren County. And that's something that I think a lot of people don't really know about is there's not fluoride in our drinking water. And a lot of people just assume that there is, but there's really not. So, not only is brushing our teeth really, really good for kids, but is there also anything else that we can do? Maybe, something called flossing. And how do you get your kids, if you can't even get them to brush their teeth, how are you supposed to get them to floss? And I mean, it's something that even adults are struggling with. So how do you remind yourself to always floss, and what are the benefits of flossing?
Completely agree with you. I think flossing is something that I think it's the most underrated thing. It's something that people just really, I'll tell people, okay, make sure your kids are flossing their teeth. And then the parent turns around and says, yeah, you need to brush your teeth. I'm like, well, the floss too. So when you're brushing your teeth, there are just surfaces between your teeth. No matter how hard you try, that toothbrush is not going to get between your teeth. It's not going to push the bacteria out from between your teeth. So if you're somebody who's prone to getting cavities, you're going to have acid sitting between your teeth that no matter how much you're brushing, you're going to get cavities between your teeth if you're prone to cavities and don't floss. Now, if you're somebody who doesn't get cavities, why do you need to floss? Those germs that I was talking about that cause gum disease, they really do like to live between those teeth. And eventually they will harden, and you have to get that removed by hygienists to prevent that bacteria from causing issues and going into your bloodstream and things like that. And that's when you hear those things about the American Heart Association saying, make sure you're going to your dentist, because these bacteria in your mouth, if you're not appropriately getting them removed by the dentist and you're not doing a good job brushing and flossing, they can really cause some major systemic health effects like preterm birth and heart disease. And they're finding a lot of correlations between oral bacteria and other systemic conditions. So make sure you're flossing that bacteria out of your mouth, not just brushing it away.
Yeah, absolutely. And it's great that you bring that up, that there's not only does the bacteria in your mouth affect your oral health, but it also can affect health in other parts of your body. It can affect things like, your heart. It can affect things like a pregnancy. There's many, many, many studies that show that these two are kind of related, and more are coming out every day. And so with that, there's always, you got to make sure you brush. You got to make sure you floss. You got to make sure you do it 2 minutes a day, twice a day. And how do you keep track of all of this? How do you keep it as a habit? Not only because 52% of children from 6 to 8 have cavities, but also there's an even larger percentage, I think of 70 to 80% of adults who are having gum disease or gum issues, according to the CDC. And so it's not just a child thing, but it's also all the way up to adults. So how do you kind of tell an adult, hey, you kind of need to take care of your teeth? How do you navigate that conversation?
So I mean, with kids and adults, it's very difficult to start from ground zero, basically, if you're somebody who needs a fresh start. So one tip that I work with the hygienists a lot, and they agree with the same, is we're saying you brush 2 times a day, 2 minutes, floss. A lot of times we say start with one goal. If you are somebody who needs to improve your oral health, why don't you just start by brushing your teeth every single night before you go to bed? Once you get that tackled and that's become part of your routine, then add something else, then add the flossing. And then after that, add the morning brushing. In terms with kids and getting them motivated, honestly, I will say from coming from a parent, a lot of times, no matter what you say, it's just you can't win because you don't know anything as their parent, and other people seem to know a lot. So I say if you have somebody like their dentist or somebody that can talk to them and explain to them on very simple terms, you have germs that live in your mouth, they eat your food, they poop acid on your teeth. If you don't brush that off, it makes holes in your teeth. I've actually seen kids, when I explain it and break it down to them like that, then be like, wow, ew, gross, acid on my teeth, germ poop on my teeth. And I've heard from parents, they actually will go brush and floss their teeth. I explained to them, you can't get those germs out from your teeth without getting the floss between your teeth. The acid gets stuck and your toothbrush can't get in there. That seems to make them understand a little bit more. And those flossers for kids, although they don't move up and down the tooth as perfectly and as guided, I find those are one way that you can get floss in there a little easier for young kids. And then this is actually a technique tip I have for people with flossing, is kids really hate when you stick the floss between your teeth and you push it down into their gums. They're going to say it hurts and they're never going to want you to floss. What I want you to do is you just stick that flosser kind of between the contact of between their two teeth and move it back and forth like a saw, just gently, and a slight downward pressure. It'll go down, kind of rub both sides of their teeth, and that'll be much more comfortable for them. But definitely don't forget that floss, because it is just as important as brushing your teeth.
All righty, awesome. And are there any other ways to kind of take care of my teeth? Any other ways that I can kind of make sure that I have the best teeth possible besides just brushing and flossing? Is there anything else that specifically can really help out with your dental health?
100%. And this is a conversation I have with a lot of people who are cavity prone, is if you have these germs that cause cavities, like I said, they eat your sugar and they eat your carbs. Now, they will attack your teeth much more and produce much more acid if you're somebody who eats all throughout the day and eats for long periods. So if you're like, I'm brushing, I'm flossing, I'm still getting cavities, I don't know what's going on. The problem is your teeth are in contact with foods or drinks that have sugar or carbohydrates in them for too long. So you want to group those things together. You want to kind of eat all at once, drink anything that you're going to drink that has sugar in it at one time, and then you're going to want to give your mouth a break for a while. So don't eat for a little while, or if you do eat something, eat a protein or a fat. And if you're going to drink something, make sure it's sugar-free. And that can help you a lot if you're somebody who gets a lot of cavities, even with brushing and flossing.
Oh, there you go. More, and as we kind of talked about, there is ways to keep track of the 2 minutes. So that you had the timer, you had the YouTube generation, and make sure you had the song on for 2 minutes. Are there ways to make brushing more enjoyable for the kids? Are there ways for, as a parent, kids always want to have fun. What is the best way to kind of make brushing teeth more fun for the child?
Like I said, when I saw that the toothbrush, that it said that it makes it a game, I was like, actually, I think that's the one way to reach this generation. Now there are some gimmicky things that you want to be careful of. For instance, I've seen those horseshoe toothbrushes, which we were all really excited about, hoping that those would help a lot of kids who have some sensory issues. We have found that if you do those like plaque staining tablets, and then you put the toothbrush on, it doesn't do a lot. So be careful of a lot of those gimmicky things. But the one that I was talking about, I think it's called Hum. I don't work for them or anything. I just saw it and I thought it was a really good idea. I believe it's just like a standard electric toothbrush, and it has an app that allows them to kind of play a game. But in general, make it fun. Put on a song, make up a toothbrushing song. Say, I do this side and then you go. You just got to kind of be creative and do whatever you can. And at the end of the day, if toothbrushing isn't the most fun for your kid, I mean, neither it or a bunch of the other things that the showering and things like that, that they have to get done. It's just something that has to be part of their routine. And once you make it part of their regular day, it should be a little easier to instill in them.
And I always hear 9 out of 10 dentists recommend. And so what really is, in your opinion, what is the best toothbrush and toothpaste combination? What is the best way for somebody, if I'm going to the store, what should I buy in order to make sure that my teeth are going to be the cleanest?
So any toothbrush that you use, you want it to be a soft bristle toothbrush. You don't want hard bristles or medium bristles, because that's when you can accidentally brush away your gums. But a manual toothbrush works great if you're doing a good job. If you're somebody who has a harder time with the motions and your hygienist is saying your teeth aren't as clean, there have been more recent studies that show electric toothbrushes are a little bit better, especially with kids. So I would recommend, if your kid is struggling with brushes, trying an electric toothbrush. And they sell models that are pretty cheap down to ones that are a little bit better. Some of the ones that we really like are the Oral-B and the Sonicare. But really, any toothbrush that you're using that you're using is the most important. And then in terms of toothpaste, I much prefer toothpaste that have fluoride in them. And for children, you want to make sure if they're not spitting, just use a smear the size of a grain of rice. And once they can spit, you can use a pea size amount.
There you go. And I think the amount is always an important piece. And actually, you know what? There's a great debate for me. And it's, how do you put toothpaste on the toothbrush? Is it water first and then the toothpaste and then water again, or is it just toothpaste and then water? What's the best way to make sure that I have the most toothpaste on my toothbrush?
I would probably say water toothpaste.
Okay.
Mainly personal preference. Because I would say if you're doing your water after your toothpaste, you're probably rinsing a little bit off there. So I would probably go water toothpaste, but I'm not going to be the pickiest on that one. As long as you're brushing your teeth, I'll be happy.
Absolutely. They're fantastic. And, again, we want to give you guys a chance to kind of highlight the Pediatric Dental Group of New York and, what you guys can offer for our community and just in general, what you guys do for everybody here. It's not very often that the dentist gets thanked. So, we obviously want to give you guys a platform to really kind of show that, hey, we're here for you guys. And, as the dental office, what kind of things do you guys provide for us here in the community?
That's great. So I started working for Pediatric Dental Group of New York 1 year ago. And this is the second practice I've been at since graduating. And I feel like I've found my home here. I'm really happy. All of the dentists that work here, we love and care about children, and we want to just make their dental experience better for everyone. So we try to just make sure that the experience is as happy as we can make it, and that their teeth are being treated to the best that they possibly can. So some services we provide here, we see patients starting as early as they have teeth. So we typically recommend a first dental visit by about 1 year or 8 teeth. And so we'll start with those baby dental visits, and then we can actually do something as well called silver diamine fluoride is something that we use, which is a little more conservative way that if you have a young kid who has cavities, we can help try to arrest those. We also do provide sedation services for dentistry, because we know that young kids can have a really hard time getting through treatment. So if they do need a little bit of extra medication to get them through treatment, we provide those services as well. And we also provide a service of going more to a hospital setting for kids who really have extensive dental needs that would be better treated and just being fully asleep and getting their treatment done all in one visit. And then what I do most every day is I do a lot of treatment with laughing gas for kids who just have a little bit of anxiety. I love working through it with them and trying to get them through their appointments with a pleasant experience, and one that they feel like they're willing to come to the dentist again.
Absolutely. And you talk about the willingness to come to the dentist. How do you get your child to kind of get over that fear of going to the dentist?
So that's our job, is to try to make it the most positive thing we can. We know that the dentist isn't always going to be the most pleasant, the most fun experience, but any way we can, we're going to try to make it the most pleasant that you possibly can. We have fun little prizes for the kids. And I know I'm somebody who I kind of start by like, I don't always go to their mouth to start. I always try to just talk to them first. There was a wonderful hygienist I've met along my training who she said to me with those really scared little kids, she was like, I was like, how do you do it? You seem like a child whisperer. And she said, tell them you don't want to see their teeth. And so just taking time, we do take the time to build the rapport and things like that. And I know Dr. Sani has been seeing, who owns the practice, has been seeing some of these patients since they were babies, and now they're leaving their practice or bringing their own kids. And it's just really neat to see the relationship that they've built over all these years.
Absolutely. And I mean, the relationship is probably the biggest portion. I mean, it's really hard as a young kid to kind of get toted around everywhere with a bunch of strangers that are poking inside of their mouth and, checking up on them and saying this and telling them that. And it's a really weird thing as a child. So,
One thing I love about our office is Dr. Sani actually had some people come in and do murals on the walls. So our entire walls are just covered in like paintings, and it's a really fun, kid-friendly environment where I don't think they feel like they're in their standard, doctor's office or like hospital like setting.
Yeah.
It's very kid-friendly and kid-centered, it's very important to us.
Yes, absolutely. And I mean, it's a super, super duper important part. And, many adults, I know very many people that are close to me where they had some rough experiences as a child with the dentist, and they're terrified of the dentist still to this day. And it's like, 20 years later and they're still afraid. But, it's really interesting just kind of to hear about dental health and how it's not just connected just to our mouth, but to other things in our body, and how, there's literally acid on your teeth. There's germ poop. There's, all these things on your teeth, and, cleaning them is obviously really, really big. And before, we kind of wrap things up here, if you wouldn't mind just kind of like summarizing the general guidelines, how often should I be flossing? How often should I be brushing? Should I be eating healthy foods? What are some things that I can do to make sure that my teeth are going to be the healthiest?
So we want you to brush 2 times a day with a little bit of fluoride toothpaste. We want you to floss once a day. That's just as important as the brushing. I always tell people if it's really a fight for you, I personally feel nighttime brushing and flossing is more important than getting that morning brush in if you really got to cut corners somewhere. In terms of a diet, you want to be trying a healthy, well-balanced diet is really going to benefit your mouth as well. But just make sure that with any diet that you have, that if you're somebody who's prone to cavities, that you're not eating all day long and grazing. Try to get yourself out of those grazing habits and eat a little more controlled meal times. And then in addition, try to go to your dentist 2 times a year at least once, just to make sure that everything's under control and that you're not letting anything slip. Because I will be honest, cavities, by the time they bother you, they're a bigger and more expensive problem. And something that probably could have been easily fixed with the filling is going to be a lot more extensive. So definitely just make sure you're having somebody keep an eye on those teeth. I find that's a problem that a lot of 20-year-old kids start having, and they don't go until they're about 30, and then they're a few years behind when they should have gone.
Absolutely. There's a lot of people that are definitely like that. And obviously thank you guys so much for, coming on to our podcast here. We really appreciate what you guys are able to do. Pediatric dental health, it's a hard topic to teach sometimes. But having people like you guys, having your staff there and making sure that children are more comfortable with the dentist, and like you said, building that relationship is really, really important. And we really thank you guys for all that you guys do. As we wrap up, my name is Drew Crawford. I'm a public health educator here at Warren County Public Health, here with Dr. Molly Kovaleski of the Pediatric Dental Group of New York. Thank you guys so much. This was Just for the Health of It podcast, and we'll see you all.